Bladder cancer occurs when abnormal urothelial cells, which are the cells that line the inner surface of the bladder, ureters, and urethra, grow out of control. When abnormal cells continue to grow, they can form tumors within the bladder lining. Bladder cancer can be non-muscle invasive. This means that the cancer cells are in the tissue that lines the surface of the bladder, but have not spread anywhere else in the body. In some cases, bladder cancer can be muscle invasive, meaning the cancer has spread to the muscle layer surrounding the bladder lining. At some point, bladder cancer can metastasize or advance, meaning that it may spread to other parts of the body outside of the bladder. Bladder cancer can spread in different ways. In some cases, it is possible for bladder cancer to advance locally. This means that it has spread to the parts of the body that are closest to the bladder. This may include the ureters and urethra, the prostate in men, and the vagina, cervix, or uterus in women. If the cancer has metastasized, it is most likely to spread elsewhere, such as lymph nodes in the pelvis or abdomen, the lungs, the liver, the bones, or other parts of the body. In some cases, the cancer may already be advanced at the point of diagnosis. In other cases, the cancer can continue to advance after an initial diagnosis is made at an earlier stage. Bladder cancer can also be recurrent. This means that the cancer has returned after therapy or surgery. Recurrent bladder cancer is treatable, and treatments may vary depending on the stage of the cancer or if a previous treatment did not work. Your doctor will continue to monitor the cancer following initial diagnosis and treatment. If the cancer has advanced, they will help you to understand your diagnosis and the steps you can take next. Initial symptoms of bladder cancer you may have experienced before receiving your diagnosis include blood in your urine, also known as hematuria, pain when urinating, needing to urinate more often than usual, or struggling to pass urine. If the cancer has advanced, you may experience additional symptoms and bodily changes, such as being unable to urinate, lower back pain on one side of the body, loss of appetite and unexplained weight loss, tiredness, or feeling weak and pain in your bones. Many of these symptoms can be caused by something other than bladder cancer, but it is important to get checked if experiencing any new or worsening symptoms. Speak to your doctor for more information. There are a few methods to identify if it has spread to other parts of the body. A CT, or computerized tomography scan, MRI, or magnetic resonance imaging scan, and an ultrasound scan are all methods used to produce images of inside the body. They can help detect if the cancer has spread outside of the bladder and where in the body it has spread to. If you are experiencing any bone pain, your doctor may also recommend a bone scan to identify if the cancer has spread to any bones. Based on any changes experienced, your doctor will be able to advise you if they think you should be tested for advanced bladder cancer, and they will carry out an assessment to decide which tests are the most appropriate for you. Finding out that the cancer has advanced can be very distressing, and you will likely have many questions about what to do next. Your doctor will help you work through the treatment options that can slow the progression of the cancer. These may include systemic chemotherapy, immunotherapy, maintenance therapy, and targeted therapy. Some people find it helpful to understand as much as possible about their diagnosis and treatment options. This can help you to feel more in control. It can also be helpful to talk to other people that are navigating this experience by joining an online support community or a local in-person support group. The Bladder Cancer Advocacy Network is devoted to supporting people impacted by bladder cancer. and is here to help every step of the way. There are a number of resources on the Beacon website which can help you to better understand your diagnosis and know what to expect. Please get in touch if you would like further support on any of the topics covered.